Welcome to LinkedUp, Breaking Boundaries in Education, a podcast that focuses on what is happening in education today, connecting everyone to the movers and shakers that are breaking boundaries in the education arena.
Welcome to LinkedUp, Breaking Boundaries in Education. I'm Jerry Kimball, and co-hosting with me today is Jamie Saponaro. Our guest today is Jackie Nisi. She is an assistant professor at Brown University in the Department of Psychiatry and Human Behavior. She's a clinical psychologist, and she's doing some amazing research on adolescents and how the role of social media is really impacting their relationships and how it's impacting them emotionally and socially. It's really interesting to find out what she's finding out about kids these days. And she's even being funded by the National Science Foundation and the American Foundation of Suicide Prevention. We welcome you, Jackie. We are so excited to hear about your research and what's going on. We've had other guests on our show that have talked about social and emotional learning and what's going on, but I don't think we've had anyone on that has done the research in the depth that you have done it. And so I would love to just get started by talking a little bit about some of the research findings that you have found as you are looking into how social interaction is being impacted by social media on our teenagers today. So welcome.
Thank you. Thank you so much for having me. And yeah, I'm excited to talk about my research. I think that this is such an important area, and it's something that we're learning so much about every day. Like, it's really a new area where we need a lot more research. So
Absolutely.
Yeah. So my research, I would say, sort of has covered two broad areas. So, generally, I'm interested in how social media impacts teenagers' relationships and mental health. Mm-hmm. So one area that I've looked at is how trying to understand how social media kind of differs from our traditional in-person interactions and what that means for teens' relationships with their friends and their peers. The other area that I've tried to understand better is how social media is impacting teenagers' mental health. But with really a focus on depressive symptoms and suicidal thoughts and behaviors, because we know that those things have increased in prevalence among teenagers within the past 10 to 15 years.
What I was amazed that the American Foundation for Suicide Prevention was supporting your research. So there must be some kind of correlation. Are you seeing there with suicide?
That's really the big question. Yeah. So in recent years, like I said, the past 15 years or so, we know that rates of suicidal thoughts and behaviors have increased among teenagers and increased pretty significantly. And of course, we also know during that same period of time, something else has increased, which is the use of social media. But unfortunately, right now, there still is not enough research, I think, to draw that kind of causal link, like to really say that social media is causing that increase. What we're finding so far is more that it's less about kind of how much time teens are spending on social media, and it's really more about both who they are, so the individual teens themselves and maybe what vulnerabilities or strengths they bring in, and then what they're doing online. So what kinds of behaviors and experiences are they having on social media? So those are really the things that researchers now are trying to focus on more than the kind of screen time overall measures.
Have you done research during this COVID period? And how's that going to affect things? I'm thinking this is prime time.
Question. And COVID has so thrown a little bit of a wrench in everyone, in so many aspects of society. Specifically for the research world, it's definitely made things more challenging because usually the types of studies I do involve really meeting in person with teens and talking to them directly and gathering data that way. And so we've really had to adjust. We've had to turn things virtual, a lot more Zoom. But
Right.
for my research, I think it's been really interesting because social media has become just even more of a central focus of teens' lives during COVID. I think it's
Yes.
always been a big part, but now it's a necessity for teens to be able to connect with each other. They kind of have to be using social media. So I think it's forced us to look at some of the positives and some of the things that we sort of need from social media.
So when you do your research, you typically meet in person.
Yeah.
And so now you're having to meet virtually. But how do you find subjects to use for your research? How many do you typically use? What does that data look like?
Yeah, great question. So it really varies across the different studies that I've done. So sometimes for studies, we'll do what's called an observational study, where we're just collecting a whole bunch of information, usually from a large sample of a couple hundred teens. And then we're trying to look at correlations between what they're reporting in terms of their social media use and their mental health. So in that case, we would do something like maybe go partner with a school or a couple schools in a school district, and then maybe follow teens every year over the course of a couple of years and collect some data from them every year. In other cases, so with, for example, my work with the American Foundation for Suicide Prevention, I'm working more with a clinical population because I'm really interested in seeing for really vulnerable teens who might already be at risk for things like suicidal thoughts and behaviors. I want to understand how they're using social media and how it's impacting them. So for that study, I'd be doing the recruiting, so finding participants for this study from more of a hospital type setting, like a psychiatric hospital, and then meeting, like I said, more kind of one-on-one with them to do like clinical interviews, and to ask more kind of in-depth questions.
So that way you can target based on what you're looking for.
Yeah, exactly. So
build your audience based on that.
Yes, exactly. Target this very specific population to kind of understand more what's happening for them on social media.
So you said it's not so much about the time spent, but more about the how. What do you mean about the how? What does that mean?
Yeah. So I think, so often I think our focus has been on the time spent, and I don't think that's necessarily a problem. I think it is important to be thinking about how much time is being spent online, but what we're finding is really that it's more about what teens are doing online, perhaps not surprisingly. So, for my research, that's meant, things like, we know there are risks from certain behaviors online, and experiences like cyberbullying, for example, we know is pretty highly correlated with risk for suicidal thoughts and behaviors. Other types of behaviors that I think about in my research are things like social comparison. So our teens, when they go on social media, are they comparing themselves to other teens? Maybe they're seeing, the perfect pictures of them online, and is that having an impact on their mental health? On the positive side, are they going on social media and messaging directly with friends, getting support, and sharing things about their lives? In that case, I think that social media can sometimes be a positive thing. So it really depends on how they're using it.
So you're looking at the how in terms of what types of things that they're doing. Now, with cyberbullying, I just have a quick question about that.
Yeah.
You are obviously talking to the recipients of that, but then how about those who are actually doing the bullying? What are you finding out about students who are children who are those who are imposing?
Yes. So we actually, it's good timing because my research team just finished doing what's called a meta-analysis, where we looked at every study that's been published to date on social media use and risk for suicidal thoughts and behaviors, and looked at the correlations across all those different studies. And so what we found was that the biggest effects were for getting cyberbullied. So those kids were definitely more at risk for suicidal thoughts and behaviors. But there was also a small risk for the teens who were doing the cyberbullying.
Yeah.
So sometimes I think those are the same teens. I think sometimes there's they're getting bullied and maybe as a result they're doing the bullying, or vice versa.
Okay.
But sometimes they're different teens, and it seems like there's at least a small risk as well for those kids. So there may be something about those kids where they're having a harder time that's leading them to engage in those kinds of bullying behaviors.
Yeah. I mean, I figured that because they're doing it for a reason. There's got to be a reason that they're doing it. So digging deep into why, that probably is a little revealing as well. Yeah.
Definitely. And I think it speaks to this. It also speaks to the kind of, these things we know these things are all correlated, but we don't have a lot of great evidence about causation. So what's coming first and what's coming second. So for some of those kids, it may be they're already at risk. They're already having a hard time with their mental health. And then that's sort of what's leading them to engage in the bullying behaviors rather than, the other way around.
Are there some skills that you teach them to empower them to deal with bullies online? I'm a former school counselor, so we were always working on some of those empowerment skills so that you could deal with it and kind of get the group together and support the person that's being bullied. But that would be hard to do online.
Yes, definitely. Definitely. There's now a number of really excellent initiatives around cyberbullying prevention and how to intervene and get involved. I always direct people to Common Sense Media as a great resource. All things media, but they have great resources around cyberbullying. But I in general, the guidelines typically are actually the same as they would be with in-person bullying in a lot of cases. So a lot of encouragement of bystander intervention. So if you see something happening on social media too, you try to intervene. But with social media, there's the added recommendations around things like, turning it off. So maybe blocking the person, maybe leaving that site, at least temporarily, taking a break from your phone if this is coming up over and over again, kind of giving yourself some time away from it. Because with cyberbullying, the difference is really that it can happen any time of day, as I'm sure you guys have seen in your education work. It can happen anywhere, anytime. It's often more public. Sometimes it's more harsh because the person is kind of hiding behind a screen and can say things they wouldn't normally say.
Right.
So there's some things around that I think we try to educate teens about and try to help them figure out ways to shut down some of those problematic aspects of cyberbullying.
There's something happening now too that I think is interesting. My daughter is a school counselor, and we were having this conversation this weekend. And before, we had always said, get that computer out in the living room and in front of everyone so we all know what's going on, right? And now with school happening on the computer, parents are saying, okay, you need to get to a quiet spot, go to your bedroom with the computer. So now we're sending this new message of get to the quiet spot. And, she was wondering, how is this all going to play out? Because now we're actually telling kids to go somewhere private. And, that's when a lot of that bullying happens. And there's not that adult just kind of looking over the shoulder, seeing what's happening. So
it's so challenging. So challenging for families right now. Like there's all these new things coming up with the pandemic.
The new world. That we live in. Because that was one of the things, is just making sure everything is in the open and parents are watching. Also, are there times of day that more of the bullying happens? Is there research that shows that it happens like after 10 o'clock at night or anything parents can hold on to?
That's a good question. I actually don't know if there's any research specifically looking at times of day, but I do know that, the times, like you said, when kids tend to be kind of alone with their devices, do tend to be more kind of at night, later at night. And that's oftentimes when kids are using their devices the most. So I would expect that that's usually when things tend to come up.
Absolutely.
So you also mentioned that part of your research is on how friendships are impacted. So what have you seen between what's going on now as opposed to 15 years ago with those peer-to-peer friendships.
Yeah. So in my research, I've tried to kind of take a step back from this and really think about what is different about social media compared to what we've always known about our interactions. And so there's a few, I think, important kind of features of social media that change relationships. So, we know that it's more public, meaning things tend to be shared with a bigger audience. It's available any time of day, obviously, which is very different. It's, I think an important thing is that it tends to be very quantified, meaning that you can count every interaction, every number of likes that you get, the views that you get. And that's such a huge component of what's happening in relation to peers on social media. And then the other thing is that it tends to lack interpersonal cues. So you don't typically get the nuance of like the tone of voice or facial expressions. In most cases, it's more, something that's shared and maybe it's just text or a photo. And it's just, you don't get the same kind of richness as you would in an in-person interaction. So I think all those things combine to really make a difference in how teens are interacting with each other. So they're now expecting that they can get in touch with friends and that friends will be available any time of day, like truly any time and from any location. They may be more attuned to things like their social status or popularity, because those things are now so obvious with the kind of publicness and the quantified number of likes and that kind of stuff. So I think there may be a bit more of a focus on that. And then I think with the kind of lack of interpersonal cues, I think in some ways that can encourage teens to do things like more self-disclosure and sharing because they maybe feel a bit safer behind the screen. And on the other hand, like we talked about with bullying, I think that sometimes it can also lead to saying things you wouldn't normally say in a more negative way. So I think there's positives and negatives to all of that.
Oh yeah, absolutely. You have a different bravado that you wouldn't have in person, right? So that you feel more comfortable saying something that you normally wouldn't in person, or like you said, the cyberbullying and the negative.
Yeah, and I think teens are very aware of that. I think too. When I talk to teens, I think they know that the way that they interact on social media is different, and they know that certain people are maybe more likely to be different on social media than they would be in person. And it's a big component of their social lives.
Yeah. Some of my daughter's friends prefer to FaceTime, and I love that. I love that they do that because they can have that, especially if they are not together as often, right? At least they can have that different type of interaction too. So I appreciate that.
Yeah, a lot of times when I am talking to teens about their social media use, I'll try to encourage them to use things like FaceTime, like things that more closely kind of mimic a traditional in-person interaction. Not that, all social media use is bad, but I do think that there's something different that you get from a FaceTime interaction versus a text message interaction, for example. Yeah.
So in terms of mental health, and I don't know if there's any correlation, but I do know that we have this phone in our hands that allows us to connect to anything. And we always want to know what messages there may be or what likes there may be. Have you noticed an increase, I don't know, maybe OCD or something that just, they obviously have FOMO, and that is something that keeps them always wanting to connect to their phone. So I love the idea of disconnecting sometimes, like you mentioned before, but a lot of times they just can't. How does that come into play, right?
Yeah. So I don't know about any specific connections between that kind of, pressure to engage and anxiety symptoms specifically. I would guess that there may be an association. So kids who are more on the anxious side might be more likely to struggle with disconnection. But I think that in some ways with social media, that's such a universal experience because
it is.
We know that social media sites are designed to provoke that. Like the way that they are designed is they are designed by algorithm where they're feeding us whatever information is going to make us most likely to click and to keep coming back. So it's really hard for teens. It's really hard for adults to put down the phone and to take a break from it. So I think, with teens, that is something that I try to encourage as well, is occasionally trying to take that break. And I think it requires some planning, I think, around doing that, especially when that's your whole social life is sort of wrapped up in that. It takes some careful consideration about kind of how you'll stay in touch with your friends, what things you're willing to do and not willing to do when it comes to social media. And yeah, I think it's definitely has that draw for everybody.
For sure.
Absolutely. And it's set up so that, is it true we get that dopamine rush when we get more likes?
Yeah. I mean, yes, I think, we get a dopamine rush anytime sort of something positive happens in our lives, and especially when it involves some kind of reward. And so definitely with seeing the notifications light up, definitely will give us a surge of feeling pretty good. I think, there are ways that we can try to structure our social media use to minimize some of that stuff. So turning off notifications is a really obvious example, but something that I think sometimes teens do find helpful, just to make it easier to kind of shut it off.
That's not always that you think it's obvious, but honestly, I don't know if it is that obvious to teens. And I think that is a really important tip. I really do. Because it really does make a difference if you turn off those notifications. I try to keep my phone off, not off. It's on, but the sound audio.
Right. I think teens a lot of times, and I think this is changing, but teens a lot of times I think are not aware of the fact that the sites are designed to encourage that sort of use and kind of compulsive use. So, sometimes I'll hear people, remind teens that there's a reason that notifications are red, for example, not a different color, because when they're red, they're really hard to not click on.
Right.
And there are so many things like that I think just sort of educating teens about that, I think can make a big difference.
Yeah, I was wondering about that. Are there some, are schools starting to do more education around the social media? And it's difficult, right? Because the teachers, many of them are not that educated themselves. We didn't grow up with it. And so a lot of times the kids know more about it than the teachers do. So
I think, it is hard. It is hard, especially because we're learning so much about it, every day, that I think, recommendations are changing, and it's hard to keep on top of all that stuff. I do think it varies by the school, from what I understand, but I do think a lot of school districts are implementing what's called digital citizenship curricula. And those vary. So sometimes I think those are very focused on, outlining the risks and that's it, don't talk to strangers, that kind of stuff. Sometimes they're, I think, more comprehensive, where they do go into, thinking about social media, how is it impacting your mental health? How can you use it in healthier ways? So I think it varies, but I definitely know that there are lots of researchers out there, including a colleague of mine at Pittsburgh, Sophie Chukas-Bradley, who is working on developing these kinds of interventions that can be offered in schools in order to help teens, understand how these sites are being designed and how that might be impacting them.
Right.
I think that's important. It's very important, because we take it for granted that it's there, but what are the layers beneath it that are impacting us?
Right.
And that's really important.
And there's just, it's so interesting that everything we see on social media really is the result of a design choice by somebody at a social media company. So we think that it's sort of all happening organically, but really it's all part of the design. It was all chosen in advance. So.
Right. Well, years ago, we did a lot of education around tobacco and how the tobacco industry would really pull the kids in, like the bandwagon and all of the ways that they would pull kids in. And I think it would be good for kids to see how social media is kind of manipulating them as well, so that they can make good choices and understand the psychology behind what's happening to them.
Definitely. And I think that's some of the messaging that's sort of people are trying to get out there now, is to help kids understand, how are these companies maybe manipulating you in ways that you're not quite aware of. Yeah.
Yes. Yeah. I think that's really good, because social media is not going away. We're going to have to learn to deal with it in a healthy way. What advice do you have for teenagers and maybe their parents and people
parents
that support
too.
them?
Yeah.
Yes.
Yeah. Because like Jerry said, we, as adults, we didn't grow up with this, right? So it's a little difficult. And as you mentioned, Jackie, as adults, we fall to the trickery of social media as well. So we're guilty as well. So how can we, teens help themselves, parents help their teens?
Yeah, I think so. For parents, I think the first thing I always try to point out to parents is that I think that parents should trust themselves. And, I do think that even though social media is so different in a lot of ways, I do think that many of the same parenting skills and strategies that the parents already have are going to be the most important thing here. So I do always try to encourage parents to have some confidence that they do know what they're doing, even though social media feels new. So the other thing I think, in general, I think the framework generally for parenting teens, but with social media too, is kind of the warm and firm approach. So firm being, set clear limits about what's okay and not okay when it comes to social media, and stick with those. And that's the hard part, because it's very, very hard. We know it's hard setting rules and it's hard sticking with those rules. But as much as parents can have in advance, with their teen being aware, like what is going to be the consequence if this rule gets broken, and then following through if it does get broken. So that's kind of the firm piece. The warm piece is exactly what it sounds like. So although being sort of strict and clear about the rules, still having a warm approach. So very validating, helping your teen understand that what they're feeling and experiencing makes sense. That you still love them despite all of maybe these things happening on social media, and really keeping those lines of communication open. Because I think one of the risks sometimes that we run into is, a teen shares something maybe negative that's happening on social media, and the obvious natural reaction is, fear on the part of the parent, and maybe then trying to limit the social media use, or to kind of shut it off, or to say, oh, you can't do that anymore online. But the risk of that is that then I think the teen feels like, oh, I can't come to my parent in the future and tell them when something wrong has happened or when something bad has happened on social media.
That's super important.
Yeah, absolutely. I think keeping the communication lines open is critical, especially with this, where we're all sort of still figuring out the best way to approach it.
Right.
And modeling, if we can.
That's modeling.
Good role models, and that's tough to do.
That's a great point. And very, very tough to do. It's amazing how many teens I speak to who talk about how their social media use is fine, but their parents are the ones that need to work on it.
Yeah, I agree.
Yeah.
So true. Yeah, modeling is good. And obviously needs to be in place, because otherwise, what are they going to learn from? So
right. Exactly.
It's so important that way. And then you also mentioned Common Sense Media too. We'll link that here too, but it is a great place to go.
I think Common Sense is really tends to be really a go-to resource. There's something else too called that sometimes I'll direct people to, called the Family Media Use Plan.
Okay.
And that's from the American Academy of Pediatrics. It's a bit more outdated now. I think it's like 2017. But it's just kind of a way to organize what your family's expectations, rules, things around media use would be in your home. And they have kind of sections for each age group, including a section for teens. Sometimes that can be a good just a conversation starter, I think.
Yeah, we actually use that in our school district. We had a professor on the school board, and he was very involved in this. And so he asked that we put that out for all of our parents when we rolled out our one-to-one. And so parents had the opportunity to set up a contract with their students, which, you know, like you said, it's not really so much the contract, it's that conversation.
Yes.
Just having that conversation. It's not really the contract, I don't think. But just talking about what are the expectations. I loved it. I thought it was a great way to talk about what the expectations are.
Did the parents tend to think it was helpful? Or?
Several of them did. Yes, they took advantage of it and really did like it. So yeah, I thought it was a great tool to have, and we just made it available at all open houses. And, you know, anytime we had a social event, we just said, hey, if you'd like to look at a contract, like you said, there were for the littles in the middle school and then high school. And they could look at it and see what they wanted to use, but not being directive and telling you how to parent. You pick what works for your family. And I liked that about it too.
Yeah, I think that's such a good approach. And I think having schools be involved in this is so important, because I think so many parents are looking for guidance, and the natural place to look, of course, is the school.
Yeah, we actually created a big refrigerator poster with some guidelines, and then the big guideline was Common Sense Media, to go there, because parents were just begging for resources, you know, how because they want to be involved and they want to do the right thing, but we just don't have a lot of experience in this area to know what to do. So, yeah.
Well, it sounds like a tool like that allows parents to be proactive. And it also speaks to your suggestion, Jackie, when you said to be firm, yet warm, right? So the contract is the firm part, yet it leads the open communication for the warmth. And so it's a talking point. So I think that's really good. And we can certainly link that in our show notes, because it certainly ties together your messaging as well.
So before we end today, I'm wondering, how do you think the pandemic is going to affect your research moving forward? And as a researcher, you probably don't want to make any predictions, but I understand that. But
it's something that, you know, I've been thinking so much about.
I bet you have.
Yeah, I think so. I do think that the pandemic has probably changed everyone's relationship with technology and social media, including teens, because it's impossible for it not to, especially now that so much is happening virtually over Zoom. We're spending a lot more time, everyone is spending a lot more time on their devices. So I think, I definitely think that it will change our relationships. How that will happen is the question. So I think that in some ways for teens, which is really what I'm thinking about. I think for teens, I think that it, in some ways maybe will force teens to think a bit more about their relationship with technology. So just the sheer amount of time and amount of daily tasks that are happening via technology, I think is just requiring people to take a step back and to say, like, what do I need this device for? When do I need to be using it? When do I want to take a break? I hear a lot more teens talking about just wanting a break from their devices because they're spending all day on Zoom school. And at the same time, I think it's reminded teens as well about the importance of social media for staying in touch with their friends. So thinking about how can I use social media in a way that's allowing me to stay connected while not sort of bringing me down and having all these negative kind of side effects that I'm not really looking for. So I'm hopeful that it will actually be sort of a positive shift in our thinking about technology, but I guess only time will tell.
So do you have more research coming up now with the pandemic?
Yeah.
More research projects?
Yeah, I'm starting up a new research project now, which is sort of just in the early stages. So there may be some that happens during the pandemic, some that, and then a lot that goes on afterwards. And this is a project funded by the National Institute of Mental Health. Again, looking at how social media use impacts teens at risk for suicidal thoughts and behaviors. And so for that project, what I'm doing a few different things, but generally I'm trying to understand types of things that teens are sharing and doing online, and seeing if we can analyze really at a larger scale social media data so that we can predict maybe who might be at more risk, maybe based on the language they're using online, the type of things they're posting, that kind of thing. And the other piece of it is that I'm trying to understand whether there are certain teens who might be more vulnerable to the negative effects of social media. So are there certain teens who maybe are more sensitive to like negative feedback they might get from their peers online? And then how can we help those teens use social media in healthier ways?
Yes. Yeah. That's what I wondered, if there was a kind of a profile of a person that was more susceptible. And so it sounds like you're kind of looking in that direction.
Yes, exactly. Yeah, exactly. Because we do know that it varies, not surprisingly, a lot across teens. Not every teen is the same when it comes to their use and how they react to it. So I think that's really sort of the next step, is to identify those teens that are at highest risk.
I have another question for you that intrigues me. Gender. Does gender play a role in this?
Yeah, that's a great question. So yes, I think in general, we think that.
I would think so. But
so in general, the research would suggest that both girls and gender nonconforming teens tend to use social media more and tend to report both more positive and negative effects of social media. So it seems like maybe those groups, at least compared to boys, are maybe relying a bit more on social media for their interactions, and that's maybe having both a positive impact and potentially a negative impact on them.
Yes. And then I have one more question. Do you find that teens overshare more than they should on social media?
That's also a great question. It depends on the teen. So I certainly do see that some teens are sharing a lot more online publicly than they would be willing to share in person, or even than they'd be willing to share privately. Some teens definitely not, but some teens you definitely see that. What's interesting though is I think for adults, we look at that and see that as oversharing. Like we see like that's too much. For a lot of teens though, they don't always see it that way. I think for teens, there's sort of, for some teens, I think there are different norms around what's appropriate and not appropriate to share publicly, maybe because they've grown up with social media. So there's maybe less of that. There's less of the sort of privacy concerns, and there's certainly less stigma around things like mental health concerns. And so so some of that we might see as oversharing, but I think they might not.
And then I have one more question. Do you structure your research to take the samples who you are interviewing and then work with them in years later to study impacts? How does that work?
Yeah, so in some studies it'll just be like a one-time, really trying to gather as much information from them as we can about like what they think about social media. For other studies, like the one that I'm about to start up, it's a longitudinal study. So when we first meet with them, we'll kind of ask about how they're using social media, we'll ask about their mental health, and then we follow them over the course of a year or two to see how their mental health changes. And the idea with that is to try to be able to start getting at some order of effects. So is the social media use the thing that's leading to these later mental health concerns? And the only way to do that is to follow them over time.
Yeah. And then, eventually it would be interesting to see as adults and how perhaps if there are any impacts later on too.
Absolutely. This is going to be the first generation that's really, truly grown up with social media from the day they were born. They were probably had a social media presence before they were even born.
Right.
So it will be really interesting to see when they're adults, how that impacts them.
So we'll just keep having you back then to find out these impacts. So that'll be great. We're really so appreciative of the work that you're doing because, I mean, it's informative for all. And so hopefully we can live healthier lives because of this. So we really appreciate your work.
Oh, well, thank you so much. And thank you so much for having me on the podcast.
Yes.
It was fun.
Yes. Thank you for being here and spending your time with us this morning.
Thank you for listening. And if you would like to stay linked up, be sure to follow us on Apple and Spotify and subscribe to us on YouTube.